Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
The older we get, the weaker our bones can become. Now, this is a fact. We certainly know that this is a problem within this country when we look at the rate in which osteopenia and osteoporosis is affecting so many Americans. And osteoporosis is technically considered a silent disease because you don't feel that your bones are getting weaker. So this is just something that you recognize once you break a bone, or if you go in and you have a bone density test done and you are informed that you have weakening of your bones, whether that's in the low back, whether that's in the hip. But what we do know is that approximately 10 million Americans have osteoporosis. And then when we look at the category below osteoporosis, which is osteopenia, we have another roughly 45 million Americans that have low bone density that puts them at an increased risk. So this is a major problem. And I want to talk specifically about what we need to focus on when it comes to maintaining healthy bones as we get older. I'm Amanda Williams, MD, MPH, and we know that there are different steps that we can implement to try to improve our bone health and try to prevent osteoporosis and broken bones as we get older in life. We obviously know that there's a couple of things that most people can point out when it comes to bone health, and that's going to be calcium and vitamin D. However, most Americans are not getting adequate amounts of these from their diet because most Americans follow a standard American diet, which is not going to be a good source of the key minerals that we need in order to maintain our skeleton. And the skeleton is beyond just that of our structural integrity to, hold us up. We have to also realize that the bones themselves, the skeleton, plays a really integral role in maintaining our minerals. And so when we think about our immune system, we think about the bone marrow, for example, we know our red and white blood cells are, formed within that bone marrow. So this is an area that we certainly just don't want to chalk it up just to, it's just aging. And so if we end up older in life and we slip and we break our hip, that's just part of it. No, this is something that we can definitely make changes to now to prevent things like that from occurring later on. We know that we want to make sure that we maintain our skeletal muscle. So doing weight bearing and muscle strengthening exercises, just, stretching and toning is very important, especially in the core. So when we think about the abdominal area, so I'm not saying that you have to go out and, become a fan of heavy exercise every day, but just basic stretching and toning and strengthening exercises can really make a huge impact. We obviously want to make sure that we're not doing things that we know can wear away at the bone density, things such as smoking or drinking too much alcohol. We obviously know that when it comes to our diet, that's kind of that first place that we can make those adjustments, making sure that we are getting nutrients in every single day that help to support the bones. So when we talk about that comprehensive approach to bone health, we don't want to overlook the role that vitamins and minerals and antioxidants play in that, and even omega-3 fatty acids. So if you adhere to a Mediterranean diet, the likelihood of you maintaining healthier bones throughout your life is going to be much greater. So we think about osteoporosis, we think about osteopenia. Clearly, most people think about osteoporosis and they think that somehow only affects women, but that's certainly not the case. We know that, 1 in 2 women over the age of 50 will at some point in time break a bone due to low bone density. But we know that when it comes to men, it's 1 in 4 men over the age of 50. So this is not an isolated issue that only impacts postmenopausal women who get that double whammy effect of losing bone mass at the same time that they're losing estrogen, because the estrogen itself helps to maintain that bone density. So that's why I say it's kind of that double effect that happens with women, but men too also are prone to significant bone loss through the aging process. And diet and exercise can play a really key role into helping to stabilize that. We know that there's a lot of different medications that people get put on for osteoporosis, but the problem that goes along with some of those is that they come with some really unfriendly side effects. So we don't want to wait until we get to that point where you go into your doctor and they say, well, this is your only alternative now, is you have to be on this really strong medication that could create jaw necrosis, eats away at your jaw. But hey, we got to take this chance. No, you want to make sure that you are doing things right now. And we know that our bones are very complex. Like I said, they play a role in terms of our immune system, but we also recognize that bone plays a role as an endocrine organ. When we think about the different hormones that are secreted, when we think about the actual matrix of the bone itself, that it is very, very complex. And we know that there are many things that will impact the complexity of our bones. So obviously we can look at age, and we know that the older we get, we have this decrease in estrogen and testosterone, so affecting both men and women, which can increase that risk for osteoporosis. There's another hormone known as SHBG, which is sex hormone binding globulin, that actually goes up with aging, and that sex hormone binding globulin can actually reduce the ability for the bone to maintain density. So I always encourage people to make sure that they have that level tested. If your sex hormone binding globulin level is really on the rise, then we know that that is a problem, because this can actually lead to higher levels of oxidative stress, inflammation, which can contribute to added bone loss. So all of these different things that we can contribute. We can look at issues with, chronic stress, depression, things that are driving up free radicals in the body that certainly can play a role into the loss of bone. Because remember, oxidative stress is a real thing when we think about bone loss. Oxidative stress is not just working at that cellular level at all cells outside of the bone. This is actually impacting bone cells as well. So all of these different things, we know that certain medications that people are put on can certainly put you at a greater risk for bone loss. When you look at corticosteroids, for example, when we look at SSRIs, the selective serotonin reuptake inhibitors, those are the antidepressant medications, certain blood thinning medications. Coumadin, for example, is one of those things that we have to look at, and that is because of the way that it's impacting vitamin K and the role that vitamin K plays in maintaining bone density. So anyone knows someone who's been on Coumadin before has been told, watch the green leafy vegetables that you're eating, because you can't have that when you're on Coumadin. Well, there's discrepancies within that, and I'm not going to talk about that in detail, but what we know is vitamin K plays a really critical role in terms of our body's ability to maintain that bone density. We can look at other chronic disease states that we know are directly associated or affiliated with bone loss. We can look at diabetes, for example. We know that insulin resistance over time can impact the loss of bone. And we go back to the issue with sex hormone binding globulin, understanding that sex hormone binding globulin, that level goes up as estrogen and testosterone go down, and this really can have an impact in terms of how vitamin D receptors are working. So across the spectrum, it's hormones, it's vitamins, it's minerals, it's all these different things that we have to make sure that we stay on top of, which is why when we look towards, what should we be doing? Well, we know diet and exercise play a role, but we also can look at things such as Calplex, for example. So the Calplex is tablets, and it is a combination of vitamin D, calcium as calcium hydroxyapatite, and it also contains within that phosphorus and boron, which is really important because we know that certain minerals, these trace minerals, play a really critical role in terms of normal bone function. So we look at things like magnesium, phosphorus, boron, for example. And in the Calplex, you are getting that phosphorus, you are getting that boron, you're getting your calcium, you're getting your vitamin D. So it's a really nice blend. We can also look at the bone powder, for example, and the bone powder has, once again, vitamin K in it, magnesium, calcium, all of the things that the bone needs. So if you want to do the bone powder, that's one option, and that's a powder, obviously, but we can also look at using the Calplex, which is the tablets. Now, if you do that, I still encourage people to make sure that they're taking additional magnesium in addition to the Calplex, because remember, all of these vitamins and minerals kind of work synergistically together to maintain the health of our bones. But there's other things that we can look at. Lysine is another thing that's an amino acid, but that's one area that I think the research on that is really quite cool. There was a study that was done, over close to 30 years now, where they were looking at lysine and calcium metabolism. This was published in the Journal of Nutrition back in 1992, where they were talking about calcium deficiency and how that contributes to age-related bone loss. And in doing that, so when we have age-related bone loss because we're not getting adequate calcium, one of the things that they were looking at is how can we actually increase calcium absorption within the intestines. And the one thing that they kind of honed in on was lysine, this amino acid that oftentimes we associate with our immune system. But what they also found was that in a particular study, when they gave oral lysine and they administered calcium in conjunction with this, they had an increase in the actual calcium absorption. So they took a group of postmenopausal women who are at this greater risk of osteoporosis, and they were looking at the rate of calcium being excreted in the urine. And when they added in the lysine, they found, wow, all of a sudden the lysine had this ability, in a sense, to almost bind that calcium. But what it was actually doing was it was increasing the intestinal absorption of the calcium. So we think about those finger-like projections within the intestines, those microvilli. And the lysine works, in a sense, as kind of like this magnet. It helps to pull that calcium in to create or contribute to a positive calcium balance. So I think that this is really kind of an interesting study. And the reason why I bring that up is because how easy is it to add in just one tablet of lysine every single day to your routine? And 500 milligrams of lysine a day can make a huge difference. It may be that you are now able to absorb the calcium from your diet in a much more efficient way. And at the end of the day, we want to do right by our bones. We want to make sure that we have all of the right nutrients on board. And so it's not just limited to calcium and vitamin D. And unfortunately, when many people go in and they talk to their physician, that's what their doctor will tell them. Oh, go ahead and take 1,200 milligrams of calcium and, maybe take 600 IUs of vitamin D. Number one, the vitamin D is usually not enough. The only way that you know is by having your serum vitamin D level tested. But on average, most people need somewhere around 2,000 international units per day. But when it comes to calcium, we don't want to overwhelm our system with calcium at one sitting because the body just can't do a good enough job in terms of being able to absorb that in any type of a appropriate way. So you want to usually stick with somewhere between 500 to 700 milligrams of calcium when it comes to supplementation. Now, there can be variations to this because a lot of it comes down to how much dietary calcium you're getting from your diet. Do you have a lot of, fresh leafy greens that you incorporate into your diet every single day? If so, then you're getting a good amount of calcium via that way. But if you're not, then perhaps you're going to be up at that higher end of maybe 1,000 milligrams of calcium supplementation per day. And which case I still advise that you would split that dose, 500 in the morning, 500 in the evening. Now, I personally prefer that people take their calcium supplementation at night. Remember the story that people were told years ago that kids that sleep well are kids that grow well. Well, there's something to that. When it comes to that intestinal absorption of that calcium, it seems to be much more affiliated with the evening, and it probably has to do with, like I said, all the different other hormones. When we think about our pineal gland, we think about the pituitary gland and the different hormones to which are secreted that may help in terms of proper calcium absorption. So this is why, if you're going to be using the Calplex, the way I would take that is, depending upon what your dietary intake of calcium is probably take 2 tablets in the evening with dinner. Or what you could do, if you're not getting good calcium every single day in terms of dietary intake, you would take 2 tabs with breakfast and then another 2 tabs with dinner. With the bone powder, maybe a half a scoop in the evening, so long as you're getting adequate dietary calcium from your foods throughout the day. If you're not, then I would just go ahead and do that full scoop at night before bed. But that's a very comprehensive formulation, is our bone powder. That is, out of all of our formulas, going to be the most comprehensive because it does contain the calcium, the magnesium, it has the vitamin K in it, it has the boron, it has silica in it, which helps with the tensile strength of the bone. I always say you don't want your bones to be like a number 2 pencil. You don't want them to be able to snap. We want to be able to have a little bit of flexibility within the bone itself. And so that's where that silica comes into play. And I had already mentioned, but the vitamin K is very important because K2 really helps with making sure that calcium finds its way to the bone and that it's just not kind of circulating throughout our bloodstream. We certainly don't want that to be an issue. So this is why vitamin K2 in particular is really a very overlooked aspect of bone health. But when you're taking the bone powder, you're getting vitamin K2, you're getting that boron, you're getting the silica for that flexibility, along with the calcium, along with vitamin D, along with magnesium. So it's very, very comprehensive. We know just from studies, when we look at these individual vitamins and minerals, the roles that they are actually playing when it comes to bone health. When you recognize that boron, for example, has been shown to actually stop that loss of calcium from being excreted again. And so I talked about how lysine could do that. We also know that boron does that too. So when we're thinking about bone health, we want to make sure our diet is loaded with foods that are naturally high in calcium. So we want to look at those green leafy vegetables. We also want to make sure that we are doing some type of exercise that helps to maintain the strength and tone of our muscles. And then we can look at something such as Calplex, or we can do the bone powder. So it just kind of comes down to a personal preference. If you want to do a powder, obviously the bone powder, extremely comprehensive. If we are not into powders, then obviously we would go with something like the Calplex, which is also very comprehensive. I would add the magnesium in addition to the Calplex. So you could do 2 tabs of Calplex and 1 tab of the magnesium glycinate, and that would really put you into a good coverage when it comes to the nutrients that the bone really requires. And we don't want to fall into that category of being that one of 2 women over the age of 50 who break a bone, or the 1 out of 4 men who will break a bone due to bone loss, of which we have so much control over. If we just make these simple changes and we include the right nutrients, we can make a huge difference in terms of the way that our bones age. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.